today, what we're going over is what surveyors are looking for in 2026. And, as far as a little bit of, I'm sure some of you guys are wondering, especially if you just joined, who's this guy? Why is he talking? Why is he here? Those are all fair questions. And so, who am I? My name's Tyler Wright. I'm a director for a company called EpiCompliance. We met Celtic, who I'm sure needs no introduction for most of you here. They're the number one, if not, I mean, in my opinion, the number one consulting, company in this industry. And so we met them 6 to 8 months ago, and they came to us with some ideas and some things to work on from a software standpoint. And so we've basically been partnering with them on a bunch of different projects. And one of the things that came out of that was, hey, how can we get everybody kind of up to speed on what's going on, in the compliance world? And so what we came up with was this free 6-part webinar series where we're going to be going over the survey pillar and staffing, and we're going to go over, all kinds of different parts of compliance, and helping you guys out, right? So that's who I am and who we are. Now, obviously, we know the reality. I don't have to tell you guys that are here that most of the things that people are getting cited for are preventable. Most are documentation related. There's a lot of things that slip through the cracks for one reason or another. And obviously, in today's world and in this industry, the little things matter a lot, right? Just like in anything else, with citations, not only are there financial consequences potentially, but star ratings and reputation, and that can lead into staffing issues and people deciding to go to other facilities, and all kinds of different stuff, right? And obviously, on top of that, we know that everything can change at the drop of a hat. Incidents, big incidents, documentation is going on as we speak, right? In some of your buildings, right? And so it's more about, it's less about having everything together when it's time to be audited or have a survey, and more about, how do we operate on a 365-day basis to make sure that we're always on track or as close to it as we can be, right? So our goals today is really three things. One, we want to provide you guys with tangible value, give you tools and a plan, right? So taking that information that Robin's going to give you, come away with some actionable steps of how this can actually change what you're doing now, today, moving forward, in easy action steps that we can take action on as soon as possible. And then, of course, what we'll do at the end, we'll answer questions. You can feel free to throw questions in the Q&A as we go, but what we'll do is we'll save those for the end for Robin. If my hair is on fire, if there is a giant spider on the wall, please use the chat. I need to know about that as we go. But other than that, we'll save the questions for the end. And of course, we'd love to get you guys some feedback. So without further ado, today's speaker is Robin Sweeney. Like I mentioned, probably doesn't need an introduction either from most of you here, but she's been in consulting for over 15 years. She does not only 20, 30-minute webinars, but 6 to 8 hour presentations and webinars and trainings and, all kinds of different things like that. So, and she's somebody, of course, that I've seen speak a few times, and it really only takes maybe 15, 20 seconds to just know, like, okay, wow, you know it when you hear it, people that know what they're talking about, that are the head of their field. And Robin's one of those people. So we're super excited to have her on today. And without further ado, I'll go ahead and have her, take over. And Robin, if you want to just let me know about the slides, and I'll turn my video on and let you take the spotlight.
Perfect. Hi, everybody. I'm Robin from Celtic. It's so nice to have you on to talk about this great topic today. And welcome, Janice, the new DNS from Minnesota. God bless you. And this will be hopefully some interesting facts for you. I am going to go off camera because I'm one of those people that I get distracted by looking at myself, and then I will come back on at the end. So we're going to talk about some compliance gaps that can get your facility cited every year. And some of the one thing that top performing facilities do differently to stay survey ready year round. So you got to track the gap. Why surveyors cite you even when your team is doing the right things? And do we have a paper trail problem? Most of the time we do. We have these big paper binders, especially the facility assessment that is required per the state operation manual, that sits in sits in the administrator's office, that hopefully somebody looks at a yearly basis. There might be missing pages, there might be missing policies, there might be missing contracts. Where do we keep all that stuff? And then the readiness myth. While people that say we're going to get ready when the surveyor comes in, and that's always going to fail. My favorite quote by Benjamin Franklin is, people who fail to prepare, you're going to prepare to fail. And this is what happens. We should be survey compliant as soon as the surveyors leave your facility and getting ready to come back in again. Okay, Tyler, next slide. So we don't need more staff. You need better tracking. And I have done many jobs in the nursing home over my more than 15-year career. That was an old slide and an old picture. And I was a director of clinical reimbursement, a VP of clinical operations. And, they let me have some fun as the VP of clinical ops. And I had one building, I couldn't get any CNA documentation done. So I said, just one day, give me some more staff. We had a low census. I didn't want to cut staff. I left all my CNAs on and I said, I bet you I am going to get 100% compliance with charting. What do you think I got with charting? Less compliance with charting. So you don't need more staff, you need better tracking. So what do surveyors find? That staff completed the task, but there's no documentation. And we all as nurses know no documentation means it was never done. How was the incident handled? Did we do some of the parts, but the follow-up wasn't tracked, like the A&Is? If we have a reportable, are we making sure we're getting all our reports in there? Do we have our interventions correct? Is it signed by the administrator in the DNS? Was the training done, but we don't have any attendance records? Do we have policies, but no evidence of implementation? So what's the takeaway from this? It's really not a people problem. It's a systems problem. A lot of people hire Celtic Consulting, and we love doing this. We love coming into buildings, and they say, we're not a 5-star. How do you make us a 5-star? Can you make me a 5-star? We absolutely can make you a 5-star. But the way we do it is by putting systems in place. You just can't say, I want to be a 5-star facility and wave the magic wand, because we have to put systems in place. The systems have to be monitored. And then over a period of time, we can get you to a 5-star. So facilities that track compliance automatically never have to wonder, can we prove that we did this? Next slide, Tyler. So for all of our friends on the call that have a paper-based compliance, that's a ticking time bomb. So binders scattered across all departments. And also our surveyor friends love to see that, the signature page is updated every time an administrator changes, a DON changes, because our binders are supposed to have signature pages. No alert when documentations is overdue, that it relies on one person who knows where things are. And it's usually the DNS or administrator. And sometimes those are the positions that change the most in a nursing home. Gaps are only discovered during survey, because how many times have we scrambled and then we're also scrambling to pull records. Where are they located? So if we had something that was digital, go back one second, Tyler. Yep, thank you. Centralized searchable compliance hubs, automated alerts before deadlines. Do we have, any staff member can locate the records instantly, real-time gap detection and dashboards that tell you where you're missing, where you're outside of compliance, or where you need to get up to date, and survey-ready documentations in seconds. All right, so our next slide we're gonna go to is, the best facilities never get ready for surveys. They're always ready because we have systems in place and the system runs without them. So you got to decide, what do you want to be? Do you want to be a reactive facility, or do you want to be a proactive facility? And unfortunately, in SNFs in our world, because of a lot of factors, and staffing is one of them, we tend to be reactive. We hear the surveyors are coming. Somebody picks up the PA and says some kind of code word. Everybody scrambles. All the department heads go out on the floor. We make sure everybody's water pictures are filled. The lights are being answered. That's reactive. Some of us panic. Some of us will start pulling records. We're finding gaps too late, and then unfortunately leads to citations. But if we were a proactive facility, we'd always feel like we were ready. Systems track daily compliance. We have alerts, flags that tell us that there are gaps automatically, and we resolve these issues in real time. So we're not sitting there wondering, oh, is this truly complete? And then we're always survey ready. So you got to decide, which facility do you want to be? Next slide, Tyler. So now we're going to get into some interesting specifics. So I pulled some documentation. Next slide, Tyler. So we're going to talk about where most facilities are getting cited. What are the top F tags? And then we're going to go in to talk about a little bit of IJs. So if everybody can guess, the most frequently cited F tag is F880, Infection Prevention and Control. Since COVID, this has been number one. It is still number one. I did pull a report from CMS for fiscal year of 26. So that's October 1 of 25 for us through September of 26. And obviously it's still going on. Of the most cited, that is the most cited tags. And what is the percentage of facilities across the nation that this has been cited in? So far, up to when we pulled this report on Monday, there were 3,932 facilities that have been cited for this. So 25% of the surveys have cited F880. So that is the most cited survey tag. So what's the intent of F80? F80 requires facilities to establish and maintain an infection prevention and control program designed to provide a safe, sanitary, and comfortable environment. And it helps, prevent the development and transmission of communicable diseases and infections. I know, I was just watching the news today. Besides the hantavirus and Ebola, which will not come into our facilities, but my goodness, we have more infectious disease going around. This is the highest risk tag in the state operation manual because it touches every department, every resident, every day. So we always want to make sure that we're compliant and ready on F880. The next one is F656 and 657, Comprehensive Assessments and Care Plans. Because I started as an MDS coordinator and I'm an MDS coordinator at heart. So we have, how do I get in trouble here? What's the intent of this tag? So F656 requires the facility to develop and implement a comprehensive person-centered care plan for each resident that reflects their needs, goals, preferences, and risks based on the assessment that we do. So MDS completes a very long admission comprehensive assessment, and then we generate a set of care plans. Lovely. That is part of our role. But then the part of the role happens to be, what happens if Fred gets a UTI 2 weeks after I've completed my comprehensive assessment? Who's getting that care plan in there? Where's the communication? Is it the nurse? Do we have our nursing staff? Your nursing staff went to nursing school just as your MDS coordinator did. We can all throw in care plans. The care plan is a fluid process in your building. It shouldn't be left up to just one person for care planning, because that's how you're going to get into trouble. And F657. So the intent of 657, it requires the facility to revise the care plan promptly when the resident's condition change. The goals are not being met if there's new meds or risks identified, interventions are ineffective or not being followed. So who's identifying it? And actually in the new proposed rule that just came out in April, they're requesting information on this, but they're requesting information to go to advanced care planning. I honestly think we're already doing advanced care planning, but that means there's going to be bigger scrutiny around care planning. So that's always fun. Now we're going to move to F tag 600 through F610. This is a wide variety. So this is a large one: abuse, neglect, and exploitation. This carries a ton of weight in a building. And this tag is, believe it or not as cited as much. It's cited about between 8 and 10% of all the facilities right now that have had a survey since this fiscal year of October 1, 25 through now. We at Celtic have done some IJs on this, try to get people back out of IJs. So what's the intent of this tag? The F600 tag, 600 to 610. These are core federal requirements for preventing, identifying, reporting, investigating, and correcting abuse, neglect, exploitation, and misappropriation of the residents' properties. Surveyors frequently cite these tags together because they represent a facility's culture, safety, and leadership insight. I'm going to give you another example from when I was a VP of clinical ops. I'm in Connecticut. Connecticut surveyors are interesting, a little tight. So I'm going to assume maybe where you live, they are too. I had a resident who had a diagnosis of dementia in one of my facilities, and she liked flavored coffee creamers. So the family brought in all these little cups of coffee creamers. On the night shift, I had a CNA ask the resident, according to the CNA and the statements, if she could have a coffee creamer for her coffee, and the resident said sure. Well, the family came in and counted how many coffee creamers were left, and there were some coffee creamers missing. And we had to interview the CNAs. We found out that CNA had said, well, this resident told me that I can have her coffee creamer. But because the resident had a dementia diagnosis and the family called the state through a long investigative process, we ended up having to let that CNA go for exploitation of the resident's property just for taking 25 cents of coffee creamers. That's how insane that this is. And then we have FTAG 684, quality of care and treatment standards. So what's the intent of this one? This one requires facilities to provide each resident with the necessary care and services to attain or maintain their higher practicable physical, mental, and psychosocial well-being. This is based on the resident's assessment, care plans, goals, preferences, and recognized standards of practice. This is one of the most frequently cited clinical tags because it applies to every resident in every discipline. So where are we citing F684? This is the fourth most frequently cited tags, and about 16.2% of the facilities so far this fiscal year have been cited on that. Tyler, next slide, please. So as you can see, we have a lot of stuff going on in our industry. So kind of deep dived into F880, but what are surveyors looking for? Hand hygiene. Hand hygiene, my friends, very important. This should be at least monthly on your staff education calendar. We should have a great yearly calendar with different educations that come out on a monthly basis, and hand hygiene should be definitely on more than 1 month over the period of a year. PPE availability, correct usage, how to don it, how to doff it. Antibiotic stewardship program records, isolation protocol, staff training logs when you do your annual competencies and on new hires, your infection tracking and trending reports. And just a little side note on that. I've been in some surveys where infection prevention logs are usually looked at, day 3, day 4 of the survey. And some surveyors are nice and go, hey, Robin, wink, wink, I'm going to look at infection control tomorrow. And what do we all do? We run in the infection control office, pull out this binder that's a mess, and try to overnight make it not a mess. So that's an issue. And then we have COVID-19 vaccination documentation. So what are the mistakes? Relying on verbal confirmation, documented proof, infection logs that aren't updated in real time. There's no systems to track outbreak patterns. Oh, have I got in trouble with that? Line lists, my friends, line lists. Training done, but no intended signature sheet. Hand hygiene audits not performed or not recorded. And policies exist and the staff can't locate them. Now, I'm going to tell you a little side note. We don't need a policy on every single thing that the state is asking. And there's nothing wrong to say we don't have a policy on that. But the big things that we're talking about right now, like F80, infection prevention and control, we definitely need policies. Tyler, next slide, please. So then we go to the most frequently cited IJ. IJ, immediate jeopardy. This is not where you want to be. So some of this information I took from the Texas Department of Health, just because I know I have a broader audience here, but a lot of this isn't always published. So I went with Texas. Their most frequent cited immediate jeopardy is F689, 32% accidents, hazards, and supervision. So what does this mean? This is requires the facilities to maintain an environment that's free of accidents, hazards as much as possible, and to ensure that each resident receives adequate supervision and assistive devices to prevent accidents. This tag is one of the most frequently cited tags because it touches almost every operational system in the SNF. It's not only nurses, it's everybody. It's lack of response to an injury, or you see, when I'm reading notes that resident was transferred by the Hoyer lift and the Hoyer lift was broken. Yikes. And I see those in notes. That's going to get you in trouble. Then what about FTAG 600? Free from abuse and neglect, kind of what we just talked about. In the F600 to the F610s, we're failing to protect from abuse. or we're not reporting abuse timely. You know, there are definite guidelines within 2 hours that we have to report abuse. That's not happening. F684, quality of care. This is a big one. So what's the intent of 684? It requires facilities to provide each resident with the necessary care and services to achieve, maintain their highest practical, physical, and psychosocial well-being, which we've heard, care plans, resident goals. This is the core clinical care tag that surveyors look at when they're looking at residents. This is your core clinical tag. It's a large tag. You should read this in the state operation manual, see how you can get into IJ territory with this. A very important part of the process. And then we have F607, abuse and neglect policies. So what does 607 do? This falls into the 600 to 610 category. So this requires facilities to develop, implement, and enforce written policies and procedures that prohibit abuse, neglect, and exploitation. And these policies have to meet the federal requirements. They must be consistently followed, and they have to be integrated into staff training. This tag is cited when there's a facility-wide system failure, not just an individual action. So that's kind of what Tyler and I are talking about today. There has to be a system, because if you're doing things individually, the system's going to fall apart and you can end up in immediate jeopardy. Maureen and I and some of the Celtic team were just at the APACN conference in Orlando back in March, and Evan Schulman talked. He's the head of the CMS, Nursing Home Enforcement and Compliance, and he's always fascinating. And he talked about the most frequent IJ tags. We actually had his guess what the most frequent IJ tag that he was seeing so far this year from his state surveyors. And I was going with F880 all the way, and he didn't. He went with elopement. So elopement, and then the second one was incorrect meals and swallowing issues. And I'm looking at, I didn't talk about this here just for, time constraints, but, getting the wrong meal, failure to identify swallowing issues can get you into IJ territory. Tyler, next slide, please. So there's some more IJs that should be on your radar. Notification of changes, F580, failure to notify physicians and responsible party of changes. So when you see those notes that, you need to make sure that it's in the note on who you notified. You just can't put MD notified. It needs to be MD, Fred Smith was notified. Or if you notified the family, you can't say daughter notified. Because if this should go to court, they're going to ask, what daughter did you notify? Because if you did notify the daughter and you just wrote daughter, she's never going to remember 3 years down the road, and she's going to say, nobody called me. Daughter Annie Smith was notified of the changes. Then we have F656, care planning, meaning that we are doing the care plans, but we're not following the plan of care. High-risk needs are not addressed. The care plans are not individualized interventions. Definitely need to make sure that our care planning is individualized. F686, pressure ulcers, wounds. We're not supposed to be making these wounds worse, my friends. Wounds worsen, lack of care, failure to monitor, prevent, pressure injuries. And I see this all the time, especially I'm in a state that loves to do case mix audits too. For pressure ulcers. And I know in a lot of states, pressure ulcers is part of your Medicaid reimbursement for quality. So we want to make sure that we're doing weekly wound rounds. The wounds are identified, that they're documented properly for size, depth, any exudate, what's our treatment, and if I have a wound that hasn't progressed in healing and it's been a certain period of time, and the wound doctor changes the treatment, that it's updated in my care plan, that the treatment's changed. You want to make sure, you want to show the surveyors that you're following these wounds and you're making sure that you're doing everything you can to prevent the wound from worsening. We're looking for healing. And then we have F760, medication errors. This is 3.4%. Omission of critical medications, incorrect administration causing harm. I have some buildings in Connecticut that we had to deal with Coumadin orders. The APRNs will write hold order on Coumadin due to a high INR. And then somebody doesn't take it off of hold and doesn't start giving it again, where then I have an issue with my INR going in the other direction. I had a home that got into consent, past immediate jeopardy into consent because their EMR, a resident went out, came back, and the EMR left the original orders in there, but a brand new nurse, and I felt horrible for her because I understand how this happened, went back in and put in the admission orders and ended up with 2 insulin orders. So this poor little old lady got 2 injections of insulin. That I don't understand how she did, but they got 2 orders of insulin injection, ended up in the ICU, immediate jeopardy, consent. So these are the things that as a DNS, you should be making sure you have proper systems in place that this doesn't happen. Next slide, Tyler. So care plans and assessment, if we do F656, F657, little deeper dive, our MDS is not updated. Failure to identify a change in condition that will not resolve itself in 2 weeks. And does a SIG change need to be completed? For my MDS friends on the call, section GG now is where we just see it decline in 2 or more areas. So we want to make sure that we're looking at section GG. It used to be G is gone. So a SIG change is coming off of section GG. Care plan gaps. The care plan doesn't reflect the resident's current needs. Surveyors compare what they observe to what's documented. So please don't ever write in a care plan that Fred needs to watch the 6 o'clock news, because I'm going to tell you, I had a building that would have been survey free if they didn't put that one thing that the man liked to watch the 6 o'clock news. Because what do you think they did? They went in there at 6 o'clock and the news wasn't on. So failure to follow the plan of care. No interdisciplinary input. Care plans need input from nursing, dietary, therapy, and social services. Missing any one is potential deficiency, and no resident family involvement. Oh, yep. We definitely need family involvement. They don't actually need to come into your building and sit there, but we can do a phone call. We can do a Zoom call. We have to make sure that we involve the family and the family is involved in care planning. Next slide, Tyler. So what actually happens when the surveyors walk in? Yep, we all get sweaty and we all panic, but there's an entrance conference. The surveyors always arrive unannounced, and they start with the kitchen and observe meal service. So I always do when the surveyors walk in, because I've got trauma from this, obviously. They walk into the kitchen, I go outside and walk around the dumpster. Because if there's food, cigarette butts, stuff that, people threw into the dumpster at 2 a.m. in the morning and didn't make the dumpster and they didn't pick it up, that's part of the kitchen tag. So I'm always going to make sure that my dumpster's clear. Resident sample. They select a sample of residents and review their care in detail, including records and observation. They already know who they're looking at. They already know what the MDS is coded before they walk in. Record review. They pull documentation, care plans, incident reports, training records, policies. And this is where the gap shows. This is where the binders get you in trouble. Staff interviews. They ask about staff procedures. If staff can't explain policies or locate records, it's a red flag. And I always, as a DNS, tell my staff, it's okay to say to the surveyor, if you don't know the answer, I'll get back to you. But then that staff member needs to come to you and say what they didn't understand. And then we've got to make sure that they understand it. And then the all exciting exit conference, where they prevent the findings. At this point, obviously it's too late to fix anything. We always can IDR it if we don't agree with it, but either you're ready or you're not. Tyler, next slide. So red flags that make surveyors dig deeper. Do we have a high complaint history? Do we have prior complaints on file signal reoccurring problems? I have one building, they literally come in every month. This is my consent building. We come in every month on complaints. Staff unable to answer questions. Like I just said, if the CNAs or nurses can't explain, say to them, it's okay. I'll get you the answer and I'll come back. Disorganized records. If they ask for something and they keep asking for something and you can't supply it, or you supply it and it looks like you just got it brand new and printed it off or made up a policy. Observable care concerns. So weight loss, pressure injuries, residents left unattended, meal observations. Any observations trigger record review. So, I've done many meal observations when I'm doing pre-survey. We always test the last tray. We test it for temperature. We test it for taste. We test, that they have the right consistency. We want to make sure that that's there. Anybody who has splints, contractures, are the splints that are care planned donned and doffed? That kind of stuff. We want to make sure that we're following the care plans. Incomplete incident reports. Are we missing follow-up documentation? No root cause analysis, delayed reporting, missing interventions, QAPIs, all this fun stuff? Or do we have outdated policies, policies that reference old regs or haven't been reviewed in a year or more? Just going to give you one quick policy update that started last year with the new updates to the state operation manual. Starting a resident on antipsychotic. Before you do that, my friends, you need to try some non-pharmacological interventions. What are they? And why did they fail? All needs to be documented before you can start a new antipsychotic or change the dose of an antipsychotic. Next slide, Tyler. So today, one problem remains. We know what to do to be survey ready, but how do we and our teams do this on a day-to-day basis to stay organized, symptomatic, and stress-free? And I believe this is where Tyler's going to come in.
Awesome. Thanks so much, Robin. All of you guys here, I want to know, did you get value out today? Let me know in the chat. I want to see you guys. Was this valuable? Was that information helpful from Robin? Like I said, obviously you can tell, just how much she really knows. And so, always great to hear from her, but would love to hear you guys in the chat, what you think, about it from Robin. Sorry, this is kind of going back and forth on me here. Awesome. Yeah. So pull up the chat. Awesome. Perfect. Sarah, Adrian, Cheryl, Janet. Yeah, we can send out the slides to you guys. And also there will be a replay as well that will be sent out. And so, we'll definitely get that out. I'm so glad that you guys found that it was valuable. As Robin had said, right? Like we now know, hey, what's going on, but also there's still a problem that remains, which is how do we do this? How do we, track this on an ongoing basis, right? Because the facilities that are doing this well, that are 4 stars, 5 stars, they've already kind of moved into the new age, which is away from policies, away from binders, away from even Excel sheets, which, I've been a fan of in the past. But, and so that's why, as we mentioned at the beginning, Celtic and EpiCompliance have been working together for about 6 months. Maureen, who you guys know, met with our founder and said, hey, I'm going in all these facilities and I see the biggest reason why people are maybe, sometimes even 4 or 5 stars, but not better, not, operating more efficiently or more organized or stress-free, or places that are 2 or 3 stars. A lot of times it's things that are kind of silly, like things are just slipping through the gaps. They're not as organized. They're not as systematic. Or, hey, when the DON is gone and she's the one that deals with everything, that's why we don't allow her to take vacations or whatever the case may be, is because we've got to have something in place in order to organize everything. And so we have, I guess I'm a bit biased, but I think we have the best software for medical facilities. And so Maureen came to us and said, hey, can we build something specifically for skilled nursing facilities? Because there's not anything out there for compliance that's built for specifically skilled nursing facilities. So we built something which has been recently released, which is the EpiCompliance SNF bundle. And I want to tell you guys a little bit about it today before we jump into Q&A here in about 2 or 3 minutes. And so this is something that is an all-in-one, everything that you need to know what to do, when to do it, how to do it, broken up into a task management system, a compliance tracking dashboard for your policies and procedures, your training, your task management, your QAPI, right? Easy to pull reports at a click of a button. You can search exactly what you need in the event of an audit or a survey, or just to send to your internal teams to keep things organized. And you don't have to go into that big book of hocus pocus spells that we call it sometimes in order to find these things. They can all be easily downloaded, transferred, things like that. So I wanted to take a couple of seconds because I'm somebody personally that, of course, is more of a visual learner. So I wanted to show you guys kind of just what that looks like real quick. So when you log in, right, if you were to log in, you would be pulled up to this screen here. I'll move my face out of the way. And you would log in and you would go to this screen right here, which would be your dashboard. And so as this loads, it's going to show us everything all in one place, broken up into HIPAA, privacy, security, OSHA, right, and skilled nursing facility. Now, obviously, this is a demo account, so there'd be much more in there for you guys, but it will show you what tasks are pending, what needs to be completed, what is past due, right? And you can even go up to your dashboard and it will show you as the compliance officer. It's going to make me log out. It's been too long. But you'll log in and then it will show you on your dashboard here things that you need to do this month, right? What is pending? When is it due? What is the due date? And that way everything's broken up. So 365 days a year, you're able to go through there and take care of that. Now, if we go back to the overview, like I mentioned, you'll be able to scroll down and you'll go through piece by piece each type: OSHA, HIPAA, privacy, security. And this is really the big piece here, right? Is our skilled nursing facility specific tasks. So all of these are things that Celtic basically said, hey, again, we're just kind of the software piece. We're kind of the computer behind all of this. But they came to us and said, hey, these are all the things that we would need. So if I show you a quick example, right, you would log in here, right, to the resident call system. You'd be able to fill this out, leave notes. Now, not only that, but whether it's somebody that's in charge or somebody that's filling in, they'd be able to say, hey, what is the procedure? What is this? Why do I need to do it? What does completion look like? What are the associated F tags? What are the associated critical element pathways that we'd be looking on this? So again, you know what you're doing, why you're doing it, when you're doing it, how you're doing it, and you've even got a reference of an appendix here, of course, that you can control F and find what you need to a little bit quicker. So you can fill all of that out, right? And go through those tasks. Now, on top of that, you can even go into what I call our QAPI Center, which is our Compliance Incident Tracking Center. And so here's an example of one, just so you have an idea, where you can go in there, you can fill out, okay, what type of incident, what type of module, what department, who was involved, what was the date, what was the time. Is there any supporting documentation that you need to attach, right? So you can pull that up, you can download it, you can look at, again, F tags, critical element pathways, any sort of other documents that you may need to attach to keep on record for, your quality and assurance and improvement plan there. Of course, you can track interviews. You can look and see, okay, what happened, who was interviewed, what was their role, what did they say, and it gives you all kinds of places there. Now, on top of that, of course, we know that it's one thing to log it. It's another to, of course, have your corrective action plan ready to go on, okay, what are we going to do about this? Not only for you in your QAPI meetings, right? But also for you to pull up, for you to send internally, or in the event that you need to send it to a consultant or a surveyor to pull it up, right? You can go up here very easily, download your incident report, right? And of course, this was a fake one that we made up. It normally would be a little bit longer, but you can go in there and everything is right there for you to pull up in, I don't know, what did that take? 10 seconds, right? And you can easily download that as a PDF, get that over to whoever it needs to, right? And so it's a one-stop shop on top of that, because not only do you have your task management, it's broken up into everything you need from compliance standpoint to be able to organize, systematize, and track everything. But also, like we were talking about, and Robin was talking about, having policies in a big binder or policies that you can't find. Well, you're only as good as what you can find, and sometimes what you can find quickly, right? So that's why we've got all of your policies and procedures here, digitized, easy to find, easy to track, easy to send. And then, of course, right, we're not really a training company, but we've got a full, suite of training in there, so you can track it, you can send out training, you can track where people are, you can send reminders. And so what a lot of people find is a lot of times they'll add something like this because this does everything, and they might even get rid of what they have as training or add this on as well. So that's a little bit. Obviously, there's much more to it, but I wanted to share a little bit of that for you guys in there and show you what it looks like. So now that is something that of course, is a little bit behind what it is. Now, of course, we built this with Celtic, again, designed specifically for you guys in skilled nursing facilities. And everybody wants to talk about AI these days. Some of you are probably already, maybe want to vomit when you hear the word AI, if you've been to a conference recently. But not only do we have AI, of course, in the product and in helping us make it, but we also have these things. I don't know if you guys have heard of them recently. They're called human beings. Yet they're great, right? They pick up a phone, they talk to you, they have a conversation. Um, and so we have people at our team, right? Not only are you able to use the system on your own, but we have a director of customer service. His name is Ray Walters. He's a real human being. He might even be in this webinar right now. That you can call, you can email if there are issues or things that you need, or you can't find stuff or you need help. And I think that's one of the best parts of the system. So we just wanted to show it to you guys. It's something that Robin and I and Maureen are incredibly excited about. It's something that was built for you guys. And so if you guys would like to learn more before we go into Q&A, I'll give you the opportunity to do that. Um, if you have your phone, you can scan that QR code if you'd like to learn more about it. What that conversation would be is really just a consulting call for us to see, hey, where are you at compliance wise? And see, like, hey, is this even something that we feel like could help you? Because, very well, maybe you do have all your ducks in a row. I don't know that, but I think it's definitely awesome to go, just like we get our yearly physical at the doctor, or we should be, right? Coming in, understanding, hey, what's going on from a compliance standpoint, learning more about the product, see if it's something that can help you. And of course, we'd be happy to answer any questions. So what I'll do is I'll actually throw this in the chat. Um, and of course, everything too with the system, if you did end up using it, you would, have a call after that in order to have anyone and everyone on your team that would need to use it. It's very simple to use. But they would get you onboarded and all that kind of stuff to make sure it's something that you can figure out in a couple hours and be up and running. We would hate to build something that would say, hey, like, it's only great if you use it, right? It's only great if people understand it and if it's easy to use, which is why we built it that way. So before we jump in the Q&A, the QR code is there. Um, and so if you guys want to, hit that real quick with your camera, make sure that that works. And of course, I did just put the link in the chat before we dive into the Q&A. If you guys could let me know that that link works, was having some issues with it earlier. Obviously, links only don't work when you need them to in these kind of events. So if you guys could just throw in the chat, if I could hear from somebody, if you could just click it and let me know that it works, that'd be great. And that way we can get on. So I'll just wait for somebody in the chat. If you could just let me know that that works. And also, like I said, if you want to do it on your phone, you can click the QR code. Awesome, Jody. Thanks. I appreciate you letting me know that. So I'll leave that in the chat for you guys. You can click that. You can go ahead and download that, or go ahead and set up your time. All it is a calendar, a link to book our calendar for me and Ray Walters, who I mentioned earlier. So it'd be me and our director of customer service to help walk you through, understand more about you. And we want to make sure that, it doesn't just work, that it works for you and your facility. Every facility is different. They've got their own specific bits and how they like to do things. And so, we always like to understand somebody first before we would recommend or not recommend even using it. So I'll leave that up there for you guys. One other thing that we do want you guys to leave with, we created a survey readiness checklist. And so what that looks like is this is just a free tool that you guys can use. And so I'll also put this link in the chat as well, real quick. But what this will look like is this really a way for you to determine, hey, where are we at? Because a lot of you guys are like, hey, I think I'm doing really good, and maybe it's not quite as good, or maybe a lot of times we're too hard on ourselves, right? Especially as leaders or administrators or DONs, we think that maybe the world's always ending and we've always got things to improve. Maybe you're doing a little bit better than you think, but this scorecard either way will help you know where are you at, right? And what are things that you maybe do need to work on. And so it's a bit of a self-assessment. And so I'll put this link in here as well. You can also scan that QR code if you like that. I'll also put this in the chat real quick for you guys, and then we'll dive into the Q&A. So I just put that in the chat. Jody or somebody else, anyone, if you want to let me know that that links works as well, because sometimes I get out of these things and everyone's like, hey, I really wanted that thing. And I'm like, and they're like, oh, the link didn't work. And then I just, you think about all the people that were probably trying to click on it. And then, you're like, gosh, I probably should have just asked. So that's what I'm doing now. So if somebody wants to let me know in the chat, I'd appreciate it. Um, if you guys have any questions there, if it works, got it, perfect. And I know there was a quick question in there. I saw it kind of coming in. Jody, thank you. Merdella, thank you. Janet, thank you. Ray, there's Ray right there. That's Ray. Um, and then Barbara said, seems like this is an AI generated system that will need a new hire to follow up, or is this a standalone? So that's a great question, and I'll answer that real quick before we go into Q&A. So with this, right, this is truly something that when you use this, this is a tool. If you have a compliance officer or a director of nursing or administrator, they're doing these things anyways. They're just doing them with books and binders and Excel sheets, and this is over there. They don't have this easily trackable. It's hard to find this, right? And so this is gathering everything in one place, right? So that you're able to really add on as a tool, right? So this is a tool for you to do everything much faster, much more organized, much quicker. And so, again, like we said, the last thing we would want to do is build something that is going to take more time for you to use it, which unfortunately, I think we all know there's some tools that are out there. You're like, is this helping or is this causing us to spend more time, right? So what this is, right, is just like a horse and buggy to a car, right? It's the same thing. We're trying to get from A to B. We're just trying to do it faster. We're trying to do it more efficiently. We're trying to do it more stress free, right? So, again, in the up and running process of learning how to use it is sometimes an hour, sometimes less. It's very self explanatory, but of course, we take care of all that. So, definitely not something you would need to hire. It's something that you can add into your current existing systems. And really, just again, it's an upgrade to everything that you're doing to make things easier, faster, less things slip through the cracks, all that kinds of things as well. So, Janice, good point there. Okay, well, it's already fixed. Perfect. So yeah, if you the QR code, if you used it, or if you download the checklist, the free checklist through that link, it will should email you shortly after. If you don't see it, of course, check your spam. I think it comes from my name, Tyler Wright, or EpiCompliance, or Ray. So one of those three. And if you don't see it, I'll have my contact information here at the end. Feel free to reach out to me, and I'll make sure that you get that if for whatever reason it doesn't work. So we've got those two links in there. I'll post those again, and then we'll jump into the Q&A here at the bottom. Um, so the next webinar, right? The next webinar in the series will be here hopefully in the next 2 3 weeks. We'll let you guys know. So be on the lookout on your email or your LinkedIn. However you found out about this last time, whether it's from Celtic's LinkedIn or EpiCompliance's email or vice versa. That's where we will keeping you guys updated. And it will more than likely be Rob and I again. And again, I'll kind of just be a host and I'll let her be the star of the show. And then, again, we're broken up. I can give you guys real quick the topics, right? And of course, we'll in the email we'll let you guys know what those topics are. But then we broken up into this was all about health inspections, FTAG, survey pillar. There will be clinical pillar, as you see there, care plans, infection control. Third will be kind of more basic program compliance, meeting your CMS provider agreement while keeping qualified staff and satisfied with residents. Part four will be policies backbone, documentation framework for every high performing facility. Part five will go into billing, clean claims, clean records, and staying off the OIG radar. And then, of course, vendor compliance, which is going to be HIPAA, insurance, OIG, all that type of stuff as well. So we'll keep you updated on that. Perfect. So, Merdella, thank you for letting me know that. So it does send for me. So you'll see it from Tyler Wright. Check your junk. Sometimes those things go there as well. So again, I'll put these two links just so they're at the bottom of our chat here. That right there would be your free consult link. So that would be the 30 minutes. I'll put that there. So feel free to sign up. We should be pretty open tomorrow before the Memorial Day weekend, or anytime next week would be great as well. And then I'll put the download link for the toolkit here, and then I'll turn it over uh, to Robin. So let's go ahead and jump into QA. If you have it, you can put it in the Q&A section